Hello everyone, my name is Dr. Nidhi. I'm an ENT specialist at Health Hub Clinic Discovery Gardens. I'm here to talk about few very common questions which I keep on hearing in our clinic very regularly. The one which takes number one spot is earwax. So what is earwax? It's a normal secretion produced by the ear. It is meant to keep the ear healthy and also protects the ear against infection. So as doctors, we tell people not to clean the ear from inside. Why do we do that? It's because ear has a self-cleansing mechanism. So the wax is produced deep inside the ear, it migrates towards the outer part and it falls off on its own when we are chewing, talking, yawning. So most of us do not need to clean our ear. A small subset of people may have problem with excessive production of wax or some problem with the self-cleansing mechanism. So it is this very small subset which would require cleaning of the ear, but it has to be done by a professionally trained person and not on our own by using Q-tips or earbuds or hairpin or any such thing. Why? Because one, we might cause trauma. Secondly, we'll push the earwax actually deeper inside, which is counterproductive. So this needs to be done by a trained person. So how do we know whether we need to be seen by a doctor or not? So an excessive earwax inside the ear is going to cause problems like discomfort in the ear, pain, discharge, difficulty in hearing. In case you are facing any such thing, please see a doctor. How frequently we should do that? That totally depends on how frequently one develops the symptoms. So it is not a fixed regime, it's a tailor-made regime for everyone. The second issue that I would like to talk about is nose bleeding. It's more relevant now that we'll be facing dry and hot summer months. It is a very common problem in children. Why is it so common? Because the lining inside the nose is very fragile. Any little trauma like forceful nose blowing or nose picking can cause the lining to break and cause nosebleed. This is the most common cause of bleeding from nose. Of course, there are many other less common causes as well. So what should we do to prevent this thing? First, do not do overpicking of the nose or blow it vigorously. Secondly, keep yourself well hydrated. So the lining of the nose is wet and moist. We can also use humidifier to keep the air humidified. We can also apply saline sprays inside the nose or saline gel inside the nose to protect it from drying. Now suppose with all these precautions, sometimes we do have a person who's having nasal bleed. What do we do at home immediately? Tell the person not to panic. Let the person sit forward with mouth open and pinch the soft part of the nose with thumb and index finger. Pinch it like so for 5 to 10 minutes. Also we can apply ice on the area surrounding the nose and on the nose. These measures most likely will control nosebleed. Suppose if it is not getting controlled after 5 to 10 minutes of pressure, kindly visit a doctor on an urgent basis. Also, you need to visit a doctor if the bleeding is happening recurrently, it is occurring without any provocation, it is excessive, a person who is having other comorbidities or has bleeding from other parts of the body. Kindly see your doctor immediately. The next topic that I would like to talk about is nasal allergy. Again, an extremely common problem all over the world. 20 to 30% of the population suffers from it. So how does nasal allergy manifest? A person will have excessive sneezing, running nose, blocked nose, itching, watering from the eyes. So we know a person has allergy. It's a problem which is a recurrent problem and very well controlled by medication. Since it's a recurrent problem, sometimes what happens, patients start the medication on their own without taking consultation. Some of these sprays which are used as medication, if taken for long term without medical supervision, can cause very serious irreversible damage to the lining of the nose. Kindly do not do that. If you need to take medication for a long time, repeatedly, please do so under medical supervision. So you can contact us on our toll-free number 800-2344. You can also do teleconsultation with all our doctors from the comfort of your home by just booking an appointment online.